Recording. Thank you very much. Got that. I'd like to welcome everybody who's here so far, and definitely welcome Siobhan and we have a lot of the county staff with us. So thank you so much.
I think I am.
You're on. Can we mute the people who are, mute yourselves until you want to say something, and then please unmute yourself. I'd like to just start introductions. We have a new member who I'm hoping will join, and so I was waiting for him to join before I did introductions, but I don't see him on yet. So I'll just start, and we can just unmute, each person can unmute themselves and just tell us where you're from. That would help. So I am Farla Kaufman, chair of FAB. It is now FAB as opposed to previously known as PHAB. So here we go. Feel free to unmute yourself. I won't call on people right now. I'll just let you all do that.
My name is Steve Orkhand. I'm a former member, still very interested, and I'm on the working committee.
Thank you.
I'm Steve Heath, and I'm the other Steve, and a current member.
Hi, Steve and Steve.
My name is Phil Summers. I am a member.
Reviewing it. As soon as she lets me know that everything is okay, then I will go ahead and email.
Hello. If you're not speaking.
You're still off mute.
Farla, you're on mute now too.
Phil, that was you.
Yeah, that's me. I'm a local ER doc and addiction doc as well. So.
Hi, Phil.
Great. I'm Libby. I'm a member of the executive committee and chair of the working committee with Phil. I'm going to pass it to Sanal.
Thanks, Libby. I'm also a member of FAB. I think I like PHAB better, Farla, and work with Farla on the youth mental health work group, as well as the executive committee with Libby and others too. Good to see everyone.
And who do you pass it to?
Good question. This requires me to work through my list.
How about Sarah?
That works great. Thank you, Farla.
Sure, I'll do that from now on. Sarah?
Hi, sure. Hi, my apologies. I'm out of the country. My name is Sarah Bowski. I work in international and domestic public health. My background's in infectious disease and some mental health. Thank you.
Thank you. Joe Phil, you want to introduce yourself? Joe Phil, he might be in session. Okay, I'll wait. Ashley, we're introducing ourselves briefly. Okay. If you're muted, you have to unmute yourself if you want to introduce yourself.
Hey, sorry. Hey, I am Dr. Ashley, a pharmacist here in the Sacramento area. I've been working with CVS for about 11 years now, and I have a hope to just get more involved, get more educated, to see how me as a pharmacist can share more preventive care and more wellness in this community.
Thank you, Ashley. Chase?
Hey there, my name is Chase. I'm trying to get our other member on, who's not on right now. I'm texting him. So he's got a link that is not working. It's saying he's not allowed to be admitted, so I'm trying to send him a link. But my name is Chase. I am an assistant nurse manager at UC Davis, and it looks like he just joined. Perfect.
Great, thank you. Thanks for that. I really appreciate it, Chase. Oh, okay. Bakalu, you're on and you're muted, but we're all introducing ourselves and I hope that you'd be on, but I'm glad you finally got to join. So would you introduce yourself?
Oh, absolutely. Good afternoon, everybody. My name is Bakalu. And this is my first meeting, so I'm so glad to be able to join this board. And to a little bit about myself, I'm a registered nurse at UC Davis Medical Center. I'm glad to meet everybody.
Thank you. Wonderful. Welcome, Bakalu. Nice that you could be here.
Thank you.
Joe Phil, are you trying to introduce yourself? Did I hear you? Mm-mm. Okay, not yet. Okay, maybe after. All right, and we have a number of staff from the county. Can we quickly go through the staff who's joining us?
Yeah. Sandy Damiano, I'm ex officio member of PHAP or FAP.
Thanks.
Olivia Casiri, health officer and also ex officio.
Good afternoon, everybody. Andrew Mendonza, health program manager overseeing the substance use prevention and treatment, clinical and program operations.
Michelle Bessie, program planner with SEPTI.
Thank you.
And I'm Siobhan Katari, Department of Health Services Director.
Good afternoon, everyone. Melissa Vizcarra. I'm also with SEPTI. I'm the program coordinator.
Hi, everyone. Glenn Sang. I'm a program planner for Siobhan Katari.
Welcome.
Hi, everyone. This is Catherine York. I'm the analyst serving Sacramento County's Criminal Justice Cabinet. I'm just here to observe today.
Welcome, everybody.
I'd also want to introduce Cynthia. Liz is out and she's actually kind of shifting in her the program she's working on. So we do have Cynthia and Chichi that will be helping with making sure that the meetings go well and also that you have your meeting minutes.
Thank you.
Thank you, everyone. Thank you, Dr. Kasuri.
And welcome, Cynthia and Chichi. We so appreciate you joining. It's wonderful to have you helping out FAB. Okay. All right. And we have a number of guests. So I'm sure we might hear from them during the meeting. But welcome, everybody. I'd like to get the ball rolling, so we have a lot of time for discussion today of a number of issues. So I'm going to put out there the approval of the March meeting minutes. I think everybody received them, all the members. And did anybody have any edits to the meeting minutes? No. Hearing none, can I have a motion to accept and approve the minutes?
So moved, Steve Heath.
Thank you, Steve. Is there a second?
A second, this is Sanal.
Thank you. Thanks very much, Sanal. Okay, so we generally, during this virtual reality, we type into the chat an aye or nay or yes or no in terms of approving the minutes. So please do that now. Great. Wonderful. Minutes approved. Thank you very much. And then we'll move on. We have a public health division update from Dr. Kasiri.
Yes, it's going to be very brief. the numbers are still down, so that is good news. We're now updating our numbers once a week, so I don't have the update for this week, but from last week it was at 3.9 per 100,000, which is lower than anything we have had since the summer of 2020. So that tells you a lot. There have been some concerns about the new variant BA2. And so we have been monitoring that with some of the surveillance systems that we have. We know that maybe between 40 to 70% of the specimens that were submitted for genotyping were BA2, but it has not resulted in an increase in cases in Sacramento or the region, or actually for the state. I know we were watching what was happening on the East Coast because there was an uptick in numbers, but it seems like that is on the downturn as well. So cautiously optimistic, and I'm beginning to get questions about, is this what we call endemic? I don't know yet. I think we'll have to wait and see what happens, but we're all very hopeful that we'll finally have a quiet summer. Recently, the FDA did approve second boosters for certain groups, those over the age of 50 and those with underlying medical conditions that put them at risk, and also those that had received the Johnson & Johnson. And so we are putting messages out. I think the reception of that has been kind of tepid because people are wondering whether they really have to do it or can they wait. But our advice is that especially for people with conditions that put them at risk, it's probably a good idea if they are 4 months out from the last shot that they got, that they should go ahead and get the second booster. That's it. You're on mute, Fala.
There, thank you. Thanks so much. That was great. It's wonderful to not have a lot of news, right? After all this time. Are there questions for Dr. Kasirye? Okay, hearing none.
From Sarah.
Hi, yeah, hi, thank you so much. Always good to get such a positive report. And I hope this question isn't too soon, but I'm wondering if anyone, or if your department's doing a review in terms of sort of any lessons learned, dare I say, in preparation for any kind of next pandemic. But I was just curious to hear if any lessons learned or reviews are being done. Thank you.
Oh, yes, absolutely. We're going to have ongoing sessions to look at lessons learned and actually just review what happened, what went right, what went wrong. So all those are part of our general process for after action. And it's happening both at the local level as well as at the state and federal level. So there's going to be a lot of lessons learned coming through. It'll take a while for us to unpackage all of this. It's been 2 years. A lot has happened. So maybe for the next update, I could start providing you with some of, at least from my perspective, what I see as lessons learned, if that's of interest.
That would be great if we can get snapshots. I think that what we're seeing in the country and in the world is that some of those lessons learned don't only apply, right, to COVID itself, but in terms of, for instance, the adaptation of how care, for other chronic illnesses was provided and the like. So there's probably a lot of primary and secondary information that would be good to learn and support your endeavors if possible. Thank you.
Phil, you had a question?
Yeah, just a quick question about monoclonals. I know the with the BA2 variant kind of taking precedent, and I know the existing monoclonals were ineffective against that, and the latest monoclonal, the betulizumab. What do we have any idea kind of what our county supply of that is at the moment. I had heard it was kind of not looking great so far. So I was just curious if we're kind of ramping that up or if that's available.
I'm kind of surprised that you got that report, but because we do have ample supply of the monoclonals, and we do survey the hospitals to see if any of them need some. That the demand has reduced a lot. There is one monoclonal, and I don't want to give you the wrong information, but there's one that was found that is not effective for the BA2, and so we stopped using it, but I'll have to get back to you on the name. It's not coming to my head right now. But otherwise, as far as supply, we do have enough. We also have enough of the pills as well, and so people should be able to get them if they need them for treatment.
Excellent. Glad I was misinformed. Thank you.
Okay. Aparna, you have your hand up?
Yeah, I have a question that's specific to the correctional facilities in Sacramento County. I'm happy to hold it towards the end of the meeting if that's preferred. Actually, I just realized that I have to drop at 1. So would it be okay if I just raise my question right now?
Is this in regards to public health, or would you rather hold it till primary health?
It is, I would like to ask Dr.
Okay, go ahead.
So Dr. Cousirier, in Santa Clara as well as San Francisco counties, the public health officer has mandated vaccinations and boosters for correctional staff. And that filled a gap in the state health officer's order because the state health officer does not say anything about vaccinations for correctional officers, be it the sheriff's department on the whole or jail staff working inside the facilities. So I'm wondering if there's any interest from you to issue such a health order specifically for Sacramento County. And to give you some context, I had raised this question to Farla a couple of months ago, and she had mentioned that the county was at the peak of COVID at the time, and you did not have the capacity to look into such a possibility. So now that things have calmed down, I'm wondering if you have.
I'm sorry, I'm having a hard time hearing what you're saying. So let me try and repeat it to see if I got the question. You stated that there are some counties that issued orders for vaccination of correctional health staff, or is it staff working in the jail? Is that correct?
Yes. So Santa Clara and San Francisco.
Okay.
Public health officers have mandated both vaccines and boosters for the correctional staff.
Okay. You know, we've had several discussions with our HR about additional mandates. We do have the mandates that are already in effect for certain sectors, such as clinical staff, such as correctional health, and our public health staff as well. It's not, and at this point, we are not anticipating having any additional beyond what the state is requiring. We have continued to encourage vaccination, and we continue to work with the correctional health staff in making sure that they have the vaccine available to get people vaccinated. And also not just for the staff, but we are also working with correctional health and have had an incentive program to provide vaccine and an incentive for inmates to get vaccinated.
Yeah, I'd like to add to that. There is a statewide order on the mandatory vaccination, including boosters. It does include some of the correctional officers. How that's been interpreted is the officers or the deputies that work in the health areas, and they are fulfilling that part. At least that's what I've heard from the chief of corrections.
Right, but there's no order for the entire sheriff's department or the jail staff on the whole, right? It is very specific to a small number. And that order, what I know from Alameda County is out of their jail staff of 1,000 plus, there's only 11 employees that work in these healthcare settings. So there's only 11 correctional officers that are under that order. So
yeah, I think I might have talked about this before. For our health side and mental health, I've required it for all employees, for all the health, all the mental health, all the registry staff that are in the jails. The sheriff's office does look at people that work in those health or mental health settings. I can't give you, I'm sorry, the exact number of officers, but it's quite a few because they have 24/7, they have 2 facilities, and there's several housing units. So I don't have that particular number.
Okay.
Given that the outbreaks have been so severe and 3 people have lost their lives, and we know that staff are a key vector for transmission in the facilities. And in addition to that, we have no knowledge of how many staff are currently vaccinated. I'm surprised that there is no inclination to look into this any further.
I appreciate your concern, and we'll definitely continue to work with HR on that.
Yeah, and just to speak to this a little bit, not to get ahead of our presentation and stuff, but we are having conversations with the Sacramento sheriffs to see what kind of data they're collecting on this, and if some of that can be made publicly available. So that is an ongoing conversation.
Sure.
Thanks, Phil.
Share that concern, absolutely.
And we'll continue to follow up on this.
I believe, Farla, that you have I don't know if there's any more questions for Dr. Kasiri before I start mine.
Are there any? No questions? I can bring up, I can share my screen with Dr. Damiano's update.
That'd be great.
Okay, here we go. Let's see. Hold on just a second. Can you see that?
Yes, thank you. And I'm sorry, there are some typos in this, and then there are some data pieces I wanted to get but couldn't because my data person has left the county. So I try to scramble to put these pieces together. So we're quite delighted with the downturn in the COVID case numbers. And I've been also watching the variant because of my concern. But you can see on this dashboard as of last week that we had a week, and it's a week I've never, ever seen in the 2 years plus I've been doing this, that we had no new cases in the jail for an entire week, and including at each jail facility. It's totally remarkable. We did have 2 positive cases, I think, yesterday, so we're going to kind of break that record, but it's a welcome relief to have that happening. We are still doing our required protocols that are required by us. I have already been having questions from both custody and from the public defender's office. Are those relaxed yet? And I've reiterated they're not. We're still following our COVID guidance. For the inmates, we have had a slow uptick since the Omicron outbreak. It's very difficult. The week prior, I think we had 76 people that had doses, but this week was a really slow week. That was last week. I didn't get the data for that. We will be posting a new dashboard today, or I think probably Thursday, on the sheriff's website. So we'll have some updated data. We do offer boosters for all of our inmates that we're trying to get them boosted. And we do continue to offer boosters for our staff and including the sheriff's department. If you can scroll down a little farther for the staff vaccines, this is point in time. You can see the medical staff are doing pretty well overall, being fully vaccinated. We're still trying to ratchet up the boosters. All the staff that are not yet boosted are required to test weekly, and we have on-site weekly testing clinics by our nursing staff. For our contracted staff, mental health are doing extremely well, 94% fully vaccinated and boosted. Our registry is pretty good, not as great as the mental health staff, and our other contractors, we have 94% fully vaccinated. So we're continuing to monitor our employees on the health side to make sure that they are all vaccinated, and we do promote that. I know many of you are interested in the average daily population, and I have seen it as high recently as 3,400 or 3,500. You can see we're in the gray color, that we're going up to pre-COVID levels, which are the blue line. You can see exactly where the pandemic started, that drop in numbers, and then we're creeping back up there. So we're having a fairly high average daily population, which makes it pretty difficult with our quarantine processes that we do for COVID. Scrolling a little bit further, I think a lot of you know this, that we have a very large number of patients or inmates, arrestees that are cited and released every single month. So in this particular month, there were 765 inmates that never made it into jail housing. So this is part of the Sheriff's Department protocol. It's a very high number. And then of course, about 57% are released within 3 days. It's an extremely high churn rate to do all the things that you need to do within this compressed time frame. And we're having great difficulties with discharge planning and some of the continuity of care, particularly for those short stay populations. We are doing a number of things in regards to the linkages and other programs in the community. Behavioral health just went live with their new forensic behavioral health full service partnership program. That's a 24/7, whatever it takes model, the highest level of mental health service intensity besides more of a subacute living environment. The provider's El Hogar, and that just went live. So we're hoping they take some of our most challenging patients from us. Behavioral health just got a grant for a project, warm handoff, and they'll be meeting with staff to figure out how they can assist with post-release. It's a time-limited program, and so they're hoping to target a certain population for that particular program. And then CalAIM, which I think you're familiar with, this is regarding the new enhanced care management benefit that health plans are offering. We've been involved in conversations with health plans since last June and partners on how to roll out this benefit. This benefit is actually supposed to start January 2023. The same time, there is a mandated pre-release Medi-Cal application. Certainly, some of our patients could benefit now from this new benefit, and that's because they already have serious mental illness, multiple chronic health conditions, high utilization rate, and for those, hopefully, we're still starting to connect those now. A number of the criminal justice partners have lots of different efforts to reduce the jail population. And I know we have in our presence Catherine York, who I work closely with, and perhaps at another meeting, she could help us talk through the adult sequential intercept model and some of the programs that are happening system-wide meant to relieve the valve within the jails. That would be a great presentation for you to have. If you scroll down, I just did a few more data points for you. One is just on the number of people with chronic health conditions within the jail. This includes serious mental illness. It includes substance use disorders, as well as diabetes and all the health conditions. As you can see, 63% of the average daily population have chronic health conditions. 66% of that group had 2 or more conditions. And you can see there's some very ill people that have 3 or more conditions. Okay, and then I know PHAB's been interested in the vacancy reports, and I want to tell you, we make traction on this. We do every month. What we're seeming to have is when we hire some of our licensed people, whether they're nurses or LCSWs, they're getting jobs elsewhere fairly quickly. And some of our long-term people are leaving. And that has to do with the supply and demand in the community and in the prisons. So as much as we kind of hire and onboard, we're not making enough traction in those areas. Okay, and those were the pieces that I put on your agenda for today. And hopefully next week I'll give you, or next month, I'll give you some other pieces of some data. I don't know if anyone has any questions.
I have to stop sharing to see the screen. So is there anyone with any questions? Libby?
Yeah, thanks, Dr. Damiano. Not so much a question, just thanks for that. And it sounds like Catherine York is somebody we should chat with, just given your description of her role and some of her insight into the reduction of jail population work. So just putting a plug out there that we'd love to connect with you, Catherine, as the working committee. And if you're able to stay for the rest of this meeting, we're going to present a bit on what our process has been to date to give you some context on our work.
Okay, and then Catherine put in the chat box the current version of the SIM, the sequential intercept model. It's kind of complicated, but it's pretty thorough. So I can talk with Farla, or Farla can let me know if that's something you're interested in. I can ask Catherine to present at this particular meeting, or she and I could come to your jail work group, whatever you would like, Libby.
Okay, wonderful. Thanks, Dr. Damiano. I'll take a look at this. It is complicated. So maybe a presentation to PHAB would be great if we can work with Farla.
I think it'll make it easier. Oh, I think Catherine wanted to say something too.
Yes, Catherine?
I just wanted to let everyone know the Criminal Justice Cabinet website does have an overview, PowerPoint linked as well. I'll throw that in the chat so you guys can see the PowerPoint overview that was done for the link I just sent you on the lengthy version. It's got an inventory of services, but that inventory of services is a representation of the partnerships between behavioral health and criminal justice agencies for people who are flowing through our justice system. It's by no means fully comprehensive, and it does get updated at least once a year. So by the end of this year, we will have another version updated and posted, but I'm happy to present and walk you guys through the SIM at any point in time.
Yeah, I think it'll be helpful. Thank you, Catherine, since I already volunteered us for this. I think it would be helpful because there's just a lot of depth to it. And I think if you're not working on it all the time, it's hard to understand it. We have, as part of the Criminal Justice Cabinet, there is a mental health work group that's comprised of members in the department. I'm on it, Ryan Quist is on it, and then all the criminal justice partners. And this is some of the work that happens. Catherine's essential in that process because she's capturing all of this information and trying to present it.
Thank you so much. Also, I just want to thank you so much for the links, plural. And I just want to say all this, the information from Dr. Damiano, the public health, primary health update will be posted on PHAB website. So you can access it from that, or if you put it in the chat and your email, I can have it sent out to you today. All right, thank you so much. That was incredibly informative and uplifting. Primary and public health, it's looking much better considering the situation with COVID now, and where it sounds like there's a lot of progress being made. So that's really welcome news after such a long haul. I just want to say right now, we're going to go to, if there are no other comments, and I don't think so, or questions, we're going to go to Andrew's update on substance use prevention and treatment, and we will have a slight tweak of the agenda. So we're going to move the youth, the PHAB activities and planning up after Andrew's presentation, and then there'll be youth mental health update, and then we'll have the working committee update at the end of the meeting, or the last item after Siobhan rejoins us. So a little movement there, so we can have some discussion about the working committee. Okay, so Andrew.
Great, thanks, Farla. Good afternoon, everybody. Here representing Lori, wasn't able to be here today. She sends her regards. Couple exciting things I wanted to share what's going on over in behavioral health services within our substance abuse prevention and treatment unit. We have a lot of great initiatives coming out. First of all, we're pushing our Narcan distribution out far and wide. As you know, we continue to be in a fentanyl epidemic and our deaths are rising in Sacramento. We're seeing death rates increase within the middle school and younger age population from fentanyl from our data from our coroner's office. And so that's extremely concerning for us. So we are working closely with our prevention partners. We're working with the state of California with our Narcan distribution project and working to get Narcan out far and wide in every place we can. We have doses here at East Parkway, but really trying to get it out to providers, out to the community, to anybody who will give it out, community centers and so on and so forth. On that same note, we are planning for a fentanyl town hall probably in May. Lori's getting some speakers together. We had one a few months ago that was attended far and wide, and we're looking to replicate that and continue to have those go throughout the year, every few months. Also, probably in late summer or fall, because Sacramento gets hot after a few more weeks from now. It'll be hot for the rest of the year, but we are looking to do an outdoor activity as well, like we did in November at the Capitol, where we have all of our providers come and we have speakers about the fentanyl epidemic and about the opioid crisis, and we're giving out Narcan and giving out resources to the community. So we're hoping to have that out in the community in probably summer or fall, in addition to all of our virtual town hall meetings that we're having. April is Alcohol Awareness Month, and so we're excited to highlight that. Our prevention providers are out there doing activities in schools, out in the community, out with families and youth, getting the word out about alcohol and the dangers that can cause, and early use of alcohol and where that places a person at risk for further issues in their life, both with the criminal justice system, issues around completing college and gainful employment. So we're hoping to get some more information out about that. The last thing I wanted to share with you all is extremely exciting, and I have Michelle Bessie here with me as well. So if there's any questions on what I'm about to share, she's here to answer your questions. But we are launching the Sacramento County Healthy Beginnings program. You may have heard of it from if you were in one of our stakeholder meetings or one of our information sessions. Michelle is leading that project on behalf of the division, and really it's working with getting information and screening intervention out to pregnant women who might be using substances, alcohol, that might be at risk for prenatal exposure, things like that, and really getting resources out there, getting education out there. We have some world-renowned experts that have joined our team on this project that are giving out technical assistance and training to our prevention providers and to our perinatal providers and the community of really getting the information out. So more to come on that. Michelle will be putting some more information together as we roll this out, but we are very excited. It comes with a new logo, branding, social media, you name it. We're really getting the word out because we're seeing, again, perinatal exposure as a continued issue in the substance abuse prevention and treatment world. That's all I have. I wanted to keep it short for you guys.
No, that all sounds great. You sound very busy, and it's very exciting to hear about the prenatal outreach activities too. That's excellent. And if you'll send us, I'm sure you'll give us an update when you have a date for the Narcan event, that we can try and spread that news. Hopefully,
yeah.
we can get something on our website. We're trying to do that, but also the members can try and help you with that outreach message.
We'd love that. Yeah, our virtual town hall will be in May, and then we're probably looking to do it probably in later summer or early fall. So when the weather kind of gets a little bit cooler. Looks like Steve has a question.
Yeah.
I just have a quick question. I applaud the efforts to get the word out online and even public events, but I do wonder whether you're able to reach the most at-risk populations for overdose in that setting. And the other part of that question is whether Sacramento County has considered having public safe spaces available for people who are habituated at this point and who are at risk for overdose.
That's a great question. Michelle and I are working closely with our leadership. We have some pretty good ideas. I can just kind of give a very high level overview right now because we're still waiting to get some details worked out, but we're looking to use vending machines out in the public, out there looking at targeting zip codes based on the opioid dashboard data that shows overdose rates and, like you said, kind of high risk populations. We're looking to have actually public facing machines, public facing dispensing out in the community. We're working with a few of our harm reduction partners as well. Right now, there's a desire to really get Narcan out to all county places, county facilities. But I think beyond that, we're looking at what else can we pair with Narcan in regards to harm reduction. And my colleague, Michelle, and I were just meeting with some folks from other states, and they were telling us about how they include pregnancy tests, HIV tests, condoms, a variety of harm reduction items with their Narcan. And so maybe you don't need it, but you have a friend who does, and able to really get all those harm reduction items out to the community and really targeting those high risk areas. So yes, hopefully, Steve, in the next couple of months, we'll have a better update of what we're actually doing and when those actually roll out. They're about $10,000 a piece. So we just have to secure some funding and secure some ways to actually get that out there. But we're looking at placing them at CPS, the treatment center on Stockton Boulevard, ERs. We met with our colleagues at Sutter Health recently that are excited and want to pair up with us as well. So yeah, it'll be out there way more, and then hopefully in the very near future.
Any other questions or comments? Okay, thank you so much.
All right.
And good luck with all of the programs that are currently, you have your hands full with all of that. It's wonderful. You're doing so much. So now I'd like to shift gears and talk about PHAB's activities and planning and the committees that we have running now and ones that we may set up soon. So let me start by saying we would like members to feel free to get involved in any of our activities. I think I'll actually share my screen with our priority topics that we have identified. Okay. Let's see. Nope, that's not it. Okay, just wait a second. Get rid of this one. I always think it's so funny because there's so many screens up, so it is hard to keep track. Just let me find this. No, does not want to. Let me get rid of this and see what comes up. No, that was the announcement. Thank you for putting that in. I will take this off and okay, let's try it once more. Too many things. I need to separate it. Well, while I'm looking for it, the Board of Supervisors asked for priorities, and here we go. And I think that I can get that one up. And PHAB usually votes on our priorities for the following year, usually at the end of the preceding year. This year it was a little different because we had a request from the Board of Supervisors for our priorities in regards to what they're setting as priorities. So it was very interesting to come up with some priorities that were supposed to be confined to like somewhat three priority lists, 5 actually. And in setting ours, we seem to have encompassed much more within this 5 numbered list. So you're all seeing this now? Yes, okay. Yes. So there are a number of things, some of which we have already started working on and made a lot of progress. You'll hear updates on our youth mental health and on the correctional health aspect of things. And there are others that we will begin to get involved with. This public health infrastructure and staffing is a big issue. We're concerned now that, or we've been concerned about this. It's been a long-standing issue, and COVID just brought to light just how underfunded the public health division has been for a very long time. It's amazing how much has been done in response to the COVID epidemic, even in spite of the understaffing, underfunding. And it's just been amazing how hard public health staff has worked and how much they've accomplished. And so we would like to make sure that the funding for them comes through to bring the staff up to the levels they need. And I think Sarah brought up the issue of looking back upon the response now that there's some time and looking at lessons learned. And I think this is one of them that we have to be very aware of. And I think there'll be some recommendations going to the Board of Supervisors about that. We have looked at the COVID response, but I think there's also within that the general emergency response preparedness that we can examine also if people are interested. And what I'm saying is there are a lot of subjects embedded in here, a lot of areas, and if one of them speaks to you, you can get involved and we can have a conversation either in a committee that we form or within PHAB for that. This includes the behavioral health continuum of care, as you see in number 3, and moving up, as I said, you'll hear about correctional health. We've definitely been very involved in that. And there is still a spot on the working committee for that area. And if any of the members would like to slot themselves into that I'm sure people would be very welcome. When I talk about these two areas, correctional health and behavioral health, I want to remind everybody there'll be an agenda item on the Board of Supervisors agenda, probably in May. It was slotted for April, the end of April, but we're moving it probably to the beginning or middle of May, where we'll be presenting the recommendations that were forwarded to them in a letter, each separate letter for each subject. They received a couple of weeks ago. We're going to present those to them, so in order to have a discussion with them in a public forum. As you know, the Brown Act is very specific about what you can do in a non-public meeting, and that means that you can't have serial conversations or meetings. And so the supervisors cannot discuss among themselves except two and not when I say serial meeting, I want to be specific. If one supervisor speaks to another supervisor, they cannot then speak to an additional supervisor. That would be a serial meeting. So this presentation to the board would enable them to have a discussion with us in public to find out more information possibly, or whatever else. And we think this is very important. With respect to the timing, the budget hearings have been ongoing, and there'll be a budget coming out, and we'd like them to make sure that they hear this and get a chance to discuss this before making decisions about where the funding will be distributed. So those two, so we'll let you know when that's happening, but it's very exciting that all of this has happened for these two very important areas. And then as we come up to the top, our highest ranking priority, you can read that it encompasses a lot. We're looking at access to healthcare and other services for vulnerable populations. The vulnerable populations, including but not limited to a very large group of many groups, homeless, youth at risk, communities of color, and those with behavioral needs, the disabled, and the services including a lot of areas as well. So this is a broad swath of a highest priority. So if these are areas that are interest to you, you can take the lead. You can suggest bring to FAB the issues that you're passionate about, and we could see what we can get going. And that includes having people come in, give presentations on areas of importance and interest, and we could look at what other issues need to be examined before we make recommendations, or make recommendations based on what we hear at the time. But I like to encourage people to get involved in areas that speak to you. You can also send other ideas. We're early in 2022, but if things come up throughout the year, and you think there are areas that we haven't covered within all of this, and we've covered a lot here, then please feel free to also bring them up. Okay, so I'm going to stop. Let me just check because, okay, it's hard to see the screen. I'm going to stop sharing. Are there any questions about this aspect of the PHAB activities and planning? You can always send me an email or reach out if you have questions or you want to get involved. Okay. The other thing I wanted to bring up is that we have the option of doing retreats, and this hasn't been explored before within FAB, but I know that there are some other boards that do this, and perhaps it might be of interest to the members to actually have a retreat. That might mean getting together in person or virtually. We could discuss that, and it might be for 2-3 hours, half a day, maybe a day, but anything's on the table. So if you have thoughts about that, or you'd like to let me know what you think, whether that's a good idea, a bad idea, I'd love to hear from you. If you have any suggestions about that, please let me know, or if you have a comment now, please share it. Love to hear your thoughts. Not hearing anything yet. Okay, so this is the first time I'm bringing this up, the issue of the retreats, but maybe you want to think about it and let me know. And at the next meeting, I'll check in and see if anybody has comments or suggestions. Also, the executive committee thought that it might be nice to touch base with the members who we haven't talked to recently, or just check in with them and see what their thoughts are. So be prepared. You might get a phone call. I think there might be an email to set up a meeting, and share whatever thoughts or suggestions you have. All right. So if there are no comments on that, then I will turn this over to Sanal to give an update on the youth mental health aspect of our activities. Hi, Sanal.
Thanks, Farla. Hi, all. This is Sanal. So Farla and I have spent the last couple months working together on some of the youth mental health issues. And as she mentioned, we'll be presenting to the Board of Supervisors next month. So we've largely been preparing for that. As we sort of look ahead, we're considering kind of where our work or efforts might go after we present and hopefully have a successful outcome. Some of the things that have sort of come up in our conversations with Dr. Quist or with folks from the County Office of Education is some other sort of peripheral issues related to youth mental health that certainly have an impact, such as like the number of social workers in school or the intersection of mental health and substance use. So it was really great to hear Andrew's report that there's a lot more youth outreach being done with regards to alcohol use and misuse. Another thing that's come up and that we've actually heard a few times, and I know this is sort of a historical problem that I'm certainly interested in doing some digging into, is partnerships between schools, health plans, and county mental health, and sort of how to bring local managed care plans to the table to be a little bit more involved with youth mental health. I know this is not a problem unique to Sac County, it's sort of across the state. But seeing sort of what's been done in that realm and ways we might be able to facilitate increased engagement. So I think that's just something we're very curious to better understand and what's been sort of the barriers in the past. A couple of other pieces is also looking into like emergency room crowding, especially as it relates to youth who perhaps don't get seen because it's so overcrowded or who leave without any care. And then the last one that Farla and I briefly kind of chatted about, which would be quite a lift, but I would be very interested to see, is doing a sort of needs assessment of behavioral health resources in Sac County. And, you know, to be honest, I don't have a strong sense of what workload that would require and sort of what's already available publicly. But given that there are such significant state investments in behavioral health last year, I think one thing that we're very interested in is sort of when a youth is having a mental health crisis or when they have mental health difficulties, where are there available resources and where can they go for help and treatment? So part of that question is better understanding what's there and what's not there. So I think these are some of the ideas we're kind of exploring for the summer and sort of moving forwards. So I guess I would just want to reiterate what Farla said. You know, it's been the two of us for the most part, and we're very open and welcome to other members who would like to join us, or even if this is not necessarily kind of where your interest lies, if you have ideas or things that you are well aware of, we would certainly love to hear any proposed suggestions on maybe where our efforts might go. So certainly look forward to hearing feedback from anyone in the group or any of our stakeholders or public. Farla, do you have anything to add on that?
No, I think you covered it all right now. But we're certainly open to questions or comments from people, or just, I think partnership. Okay, I have a comment from Steve, and partnership with mental health board would make sense. Yes, we're in discussion with them at times, and we'll try and make sure that we have more collaboration with them. And Jen said, I would like to talk, to you about mental health needs for Peds in the ER, which is a huge issue. Thank you, Jen, because that has been on my list for a long time, and it's actually a suggestion of a priority under our committee. This, we've had some really interesting presentations about the emergency room and mental health crises. And even I have to say almost a year ago, we've talked about the issue of youth and the kind of, they're the forgotten. And they're, unfortunately, when youth come to the emergency room, there are not a lot of resources for them. And they're a different population than the adults. And even the adults are, the situation in the emergency room is kind of horrendous if you're in mental health crises. So this is a very big issue that we would absolutely like more attention on. And I'd love to, I think it's my priority. So I'd like to hear about other people's interests, and really hope that other people will get involved and then we can get some traction on this subject and make some recommendations. And I know that we will be in contact again with the behavioral health about this and see what plans are in place and what plans for the future there are and where we can help. But that needs assessment is a great idea, I think, and we'll see what has been done and what could be done, and where we can make most use of our resources as a county. So thank you for the comment, Jen. We do need more resources. Any other comments on the subject?
I'm sorry, I came in halfway through, and I think you're talking about behavioral health continuum capacity and building out bed capacity. One of the things I would lift up is it might be good to have another presentation. I don't know when Dr. Quist was here last time, but have him come back. In addition to gleaning information from the RAND study, and we're gleaning it from the one that was done statewide, but then we're also doing a drill down, having RAND Corporation do a drill down on Sacramento County, and we should be getting those results, and I'm hoping May, maybe latest by June. But one of the things, the early data is pointing to the need for more subacute facilities for adults, more children's, youth, both psych facilities, but also crisis residential, crisis stabilization, as well as substance use and residential treatment. And so those are some of our gaps right now. We're working on an application for the first subacute. We have another round coming up for a facility for children's that we're working on right now, children's crisis stabilization, residential and acute facilities. August is the date that next round of funding for behavioral health infrastructure is going to be due. So there is a lot of work going on in that space. And so maybe having some regular, in addition to public health and primary health, maybe a regular behavioral health update on the topic since it's a focus area for this group. So thanks.
Thank you. So we were also specifically interested in whether there's a plan in place for diverting youth mental health crises away from the ER.
Yeah, and that's something we can certainly have Dr. Quist report on. I know there's some increased work going on in the prevention, early intervention space. But yeah, I think having him answer that would probably be better. I don't know if everyone knows Melissa Jacobs, who oversaw our children's behavioral health services, is transitioning out at the end of this week to be the Deputy Director in Adult and Aging Services for Department of Child and Family Services. So that will be a gap on our team, but we will fill it as quickly as we can for children's behavioral health because it's such an important position. But yeah, we can certainly have him come back and present on that at some point.
Yeah, that sounds great. Thank you. Anything else?
I'm sorry, did our work come up with SCOE and the schools? Did you all talk about that here?
We talked a little bit, but if you want to weigh in on that, we just gave an update on, okay. Yeah, PHABs.
So currently, our FQHC has a partnership with SCOE to put behavioral health clinicians in schools. So we have 22 clinicians right now in schools. Superintendent Gordon has a great vision and a goal to put clinicians in every school. We have are expanding our contract to be able to put 20 more in for the next school year. And we've been in discussions with the managed care plans for the use of the SB HIP funds, student behavioral health intervention incentive funding, to be able to expand that even further and think not only about clinicians but family navigators. So we have a agreement from our managed care plans to actually submit a proposal on the accelerated timeframe that would go in June to actually further expand those efforts between the school and the federally qualified health center partnership to put more behavioral health services in schools. That is going well. Thanks.
Thank you. Liz, you had a question?
Yeah, thank you so much this is such an important topic. I was just trying to support a youth last night in getting services without going to the ER, and it's really challenging. So really happy it's a priority for the county. I just had a question on the RAND study you mentioned, Siobhan. That was, I think, an adult system study. And I'm happy to hear, I think there's a study starting for the youth system. Did the adult RAND study include the incarcerated population in the needs assessment or in any way? I just know, our jail population has thousands of people in it, and a good, huge portion of that are folks with mental health needs. And so, just curious if that study included that population in any way.
No, Liz, it didn't. The RAND study really focused on bed capacity, like what types of facilities do we have? What are our needs? I didn't see a drill down in that study on specific population of need, like who needs those beds essentially. I will say there's other work going on in the county from consultants. And that's where I think, if Catherine York and our new deputy CEO, Eric Jones, can maybe do a presentation in the future on some of that, but sort of figuring out what are the needs of the population in custody from a mental health perspective, from a substance abuse perspective, what type of bed capacity should we build out to help meet those? That's absolutely something that's being looked at right now.
Yeah, thank you. Yeah, I'll just flag, because it feels like the youth study is in its early stages. I would just encourage folks to include, incarcerated youth in that needs assessment, and just flagging that, I understand that often these systems are looked at differently, but the jail population is 82% pre-trial. So folks, may or may not even ever be convicted. And so just important to remember that oftentimes incarcerated folks aren't included in these, county-wide studies, and the needs are often, I think, far greater than we realize because they're not included.
Yeah, absolutely. Thank you, Liz. That's a good point.
So I want to just read some comments from the chat, and then there's a question or a comment from Sarah. So Jen was saying that pointing to the issue of youth in EDs, and she says it can take a while to place them, and they might get placed as far away as Reno or Southern California. So that's an issue that has to be taken into consideration. Phil agreed with this and said it's incredibly challenging acutely, let alone identifying appropriate outpatient resources in the subacute phase. Also, Jen added a small population that really struggles is autism with psych issues. Many psych placement are not trained to assist with both needs. Another subpopulation there. And Libby said she apologized if missed the details of the updated public health infrastructure and needs assessment RAND analysis. Siobhan, would you be able to share more on that? I think
yeah, so a couple of things. One, I wanted to mention, we're in discussions with the Mind Institute of UC Davis Medical to talk about kids with autism and whether there's a better pathway into services for both assessments and then follow up with that. So more to come on that. We've got some interesting ideas on the table about what could work and need to pull in our regional center to have further discussions. The other thing I'll say, Libby, is what I can do is share the RAND analysis that was done, the statewide one. I'll share it to be sent out to this group. As a follow-up, knowing that that was focused on adults, we did ask RAND Corporation to do a Sacramento specific study for us and drill down on a few more details that the bigger study didn't take into account, but also on the youth population specifically. And then there is a significant amount of state funding for behavioral health infrastructure. And we're already have an application done for the subacute unit. And we are looking at now developing a new application for the second round that would work with youth in youth an acute unit. We're looking at acute unit, crisis stabilization, and crisis residential, which is more subacute. So those are the areas that we're looking at. That has to be a little further refined. We're sort of waiting for our study to be finalized so we know exactly how many beds we would be needing and asking for. So I hope that answers your question.
Thank you very much for that expansion. Sarah, you had a comment or a question?
Yeah, sorry, the chat, I'm having challenges with chat, but first of all, thank you. This is, you know, such an important topic. And my general comment was, and I'm happy to hear education came on board, that the also facility detention center and others are coming on. Mind Institute was brought up also, just given the multi-sectoral needs. I guess, and I really am in support. I like the idea of doing this assessment, Farla, that you had mentioned. I think is really critical. I guess, so within that context though, we should think about the vulnerable populations, including, you know, adolescents who are facing race-based trauma and stress in our community in Sacramento, whether it be race or other sort of areas. And how is that going, you know, how can we make sure that we're not looking at youth just as youth in general, and understanding what those subpopulations and developmental stages are that would be important in this discussion. Understanding we can't do a deep dive, however, that there's just variances within the population as we look at the sort of multi-sectoral areas. And I'm happy to support you all if you'd like me to come on board. Thank you.
Great, thank you very much. That's terrific. And I appreciate your comment about the issues of racism and how they intersect with youth mental health. There was just, I think it was the New York Times had a big piece on that. So it's definitely something that has to be considered and focused on. And this is a good arena to do that. So I'm looking for more participation, and we can move this into another arena and start talking about it and focusing on it. So thank you. I think,
Farla, have you also considered, and I don't know how this group functions in general, but for our youth work, or for youth work, maybe somewhere down the road to think about how to have some kind of youth representation or engagement in whatever's being proposed about them? Thank you.
well, funny you should mention that. I think it's wonderful that there is now a youth mental health board, which is fantastic. It was just established, and there is a youth representative on the mental health board, the adult mental health board. And I had been thinking, wouldn't it be wonderful to have a youth member on our FAB board? So the only problem is the timing, because we meet during the day and not always conducive to a student's schedule. One issue that I thought FAB might want to look at in a retreat or maybe in a meeting is the discussion about having our meetings at different times so they're more accessible to more people. I mean, I think the virtual platform has been marvelous, and we get a lot more participation from the public, and that's just terrific to me because we are public. So maybe that's another discussion. But I think it would be fantastic to have a youth member. So thank you for bringing that up, and it's on the list of things to address in the future. Okay, so now I'd like to turn our attention to the working committee update, and we've sort of touched on a lot of this, but in this discussion, but I'd like to be great for Libby and Phil to bring FAB up to date.
Great, happy to. We figured it would be easiest to update a presentation we'd given before, just to catch everybody up on process. And I know we have a few newer faces on the group today, including new PHAB members as well as new visitors. So I thought we'd just walk you through that background. Phil's going to kick off the first few slides, and then I'll kick off the rest. I know we don't have a ton of time at this point, so we'll try to kind of keep it short in case there are questions. Phil, do you want to take it from here?
Absolutely. Yeah, so just a little bit about the background. Again, we'll go through this pretty quickly. So this kind of first came on PHAB or FAB's radar in December of 2020, when there was kind of the first large jail outbreak that kind of got on our radar. We kind of continued conversations around that and held a special FAB session in March, where we had stakeholders from Sacramento Sheriff's Office, SSO, Adult Correctional Health, ACH, as well as community members, including folks from Decarcerate, that provided a lot of testimony and kind of background and insights into some of the challenges that are being experienced there. Following that, we started drafting some letters and having some special sessions in kind of response to this information that we were gathering. In May, we officially formed the working committee that has kind of continued since. And in November, we kind of, with our initial kind of information collection and everything, consolidated that into a formal letter that was issued from FAB to the Board of Supervisors. And we have kind of followed that up with another letter that was just published last month. And we'll be following that up with a presentation to the Board of Supervisors next month. So that's kind of where we're at. As far as the scope and objectives, again, this really came on our radar as we were getting kind of some conflicting narratives and noticing some discrepancies kind of between some of the policies and data that we were receiving and some of the kind of firsthand accounts that we were hearing about of people's experiences inside the jail. And so wanted to reconcile those and really develop a better understanding of this, really complex and nuanced system. Another part of this that kind of came up was the May's consent decree, which is really investigating some of the constitutional violations of the ADA Act and HIPAA compliance and provision of medical care, and kind of what the county and various stakeholders were doing to kind of address this lawsuit that the county is currently under. And that is a whole nother giant complex thing that we've kind of been wading through and trying to understand the nuances of. And the main objective kind of we've pursued is to make recommendations to the Board of Supervisors and really kind of develop a dialogue with both the Board of Supervisors and the various stakeholders around our system of incarceration to, hopefully improve some of these outcomes as they pertain to kind of physical and mental health, and then really develop some more kind of transparency and conversations around some of these issues. So our committee structure, next slide. So we are an ad hoc working committee, maximum 9 members. This is kind of all per the FAB bylaws. So maximum 9 members, majority have to be PHAB. We currently have 4 seats. Myself and Lee are co-chairs. We also have Dr. Ashley and Farla sitting on the board or the committee. And we are for one more FAB member. If anyone is interested, feel free to reach out, bringing into the fold. And then we have currently 3 committee seats, kind of keeping with the majority FAB composition of Jail Barnes, Blum, and Steve, community members that have contributed to our work. Next slide. Sources. So we have had what feels like the leaders as we can bring on, and I think now we have we've identified another stakeholder kind of working in this alternative to incarceration space. Looking forward to connecting. Has in these efforts, we're trying to understand the system. So we had some meetings with Dr. Damiano, Ricard County Council, Dr. Katari, who kind of came on board in the middle of our and she's been incredibly helpful moving all these things forward. Met with had really cool conversations with the other supervisors. We also met with the prison law office, who's the class counsel for the May's consent decree, and had a lot of guidance for us. We also met with the outgoing Inspector General, Mark, and he sent out with the supervisor for the public defenders, met with the mental health courts, and the outgoing forensic behavioral health division lead. And we've also had some more recent conversations with representatives from the Sacramento Sheriff's Office, and kind of those conversations are ongoing, particularly around kind of the data transparency. And then we are also collaborating with the Sacramento Mental Health Board, and Aparna, who spoke earlier, has been really helpful in navigating some of the COVID concerns. And we recently met with Dr. Amy Barnhorst, who is a UC Davis faculty and also works within the jail through the psychiatric service and also through Sacramento Mental Health Treatment Center. And the primary documents we've been working off of are listed here, and we can get people copies of those if needed. So these Mays consent decree monitoring reports, which are incredibly rich and cover various kind of specific topic areas. And then the Inspector General's report also it contained a bunch of really meaningful information around the process of investigating some of these deaths and other issues that arise within the jail. So that was my section, and we can kind of go on to some of our other activities. It looked like there were some concerns about not being able to hear me. Sorry.
You're better now, but there were times where you were.
I apologize.
That's okay. I think we got a lot of the most important aspects. It wasn't too terrible.
Any questions or anything I can clarify?
Okay. Maybe we can move on to Libby's part.
Yeah, sounds good. Just a quick addition on this one. So as Phil described, and as you can see on the screen, over the last year, we've had a lot of conversations, and it's a very complex area. I think we're still learning a lot. So even just today, identifying a few more conversations that we need to have to keep digging into this area. So just to say, if anybody here has further suggestions for folks we should speak with, documents we should review, it's going to be sort of a continuous learning process, and we want to make sure ahead of our upcoming presentation to the board that we've had the opportunity to just speak with as many folks as possible and kind of round out our information and our perspective. So feel free to suggest additional conversations.
I'd like to just mention that we will be speaking with Eric Jones, the new head of the Public Safety and Justice Department. I'm not sure what to call it, but that will be very helpful. Sorry to interrupt.
Definitely on the agenda. So just for those who are less familiar with the work, wanted to quickly kind of summarize the two major outputs from the group so far. So the first was a letter that went to the Board of Supervisors in November of last year. And there we were really focused on kind of the issues of high economic, social, and health costs of incarceration, the quality of services and the poor quality of services in the jails, as pointed out by the Mays monitoring reports. And then kind of the intersection of that specific picture with the broad premise of racism as a public health crisis, our commitment to addressing that from an equity lens in Sacramento County, and therefore kind of the imperative to look at how we can sort of better manage issues of correctional health and make some recommendations to the Board of Supervisors on how to bring those pieces together and really kind of fulfill our commitments around improving quality of services and addressing kind of the intersection between racism and incarceration. So that letter kind of looked at three specific things that came out in the first, let's say, 6 months of our investigations, three buckets, I would say. So the first was around transparency and accountability. And we made some specific recommendations there around one, holding public hearings on the Mays monitoring reports and on sort of related consultant reports. So kind of one of the first things I think we learned when we got into this process was there's so much information out there and it's not very easily accessible. A lot of people, ourselves included, the public, those who have loved ones who are impacted, are just searching for that information. And we think the county could do a better job of sharing a lot of that information. So we wanted to recommend not just sharing the information, but establishing a space for public dialogue on these issues. The maze monitoring reports come out every 6 months, so we'd like to see public hearings on those with the next round of reports. We also know that the county has contracted consultants to provide recommendations around reducing the jail population. And so we'd like to see a public forum for reviewing those as well to kind of increase, again, transparency and accountability on these issues. A second related piece here is to put together a dashboard with kind of key related metrics on correctional health, and that can be inclusive of some of the core metrics that are tracked through the maze monitoring reports, but also some of the data that Dr. Damiano presents to us here every month. You know, it's great that we as PHAB have access to it, but how does the public get access to it without having to sort of click many times deep into the PHAB records? We'd like to see that more publicly shared. We also at the time made some recommendations around the new agency that was being established and its leadership. So that's the Public Safety and Justice Agency, specifically recommending a candidate CEO. Of course, that selection has been made, and the law enforcement officer was selected, but we'd love to see then at least kind of that public health orientation, the equity sort of orientation come out in this person's sort of new, I guess, engagement with their role. And so we're really looking forward to meeting with Eric Jones tomorrow to find out more about how he's thinking about his leadership of that agency and bringing together that background with what we're looking for, which is somebody who's kind of thinking about public health issues and equity issues. And then there was a second recommendation around just making sure, in addition to thinking about the profile of the leadership, thinking about community engagement. And Siobhan, you actually might have an update on this, or we can talk about it tomorrow in our meeting, but we were looking for some more information about how the community is going to be engaged in the community advisory board, which we had heard about and seems to have gone silent, but you may have updates there we can check in on tomorrow. And then finally, there, when we wrote this letter, it was on the heels of another tragic in custody death, and we just really wanted to recommend, again, linking to the first bucket, greater transparency and accountability on that, so greater information sharing, and made some specific recommendations there. I'm looking at the time, so our next slide, we kind of walk through, and I updated this today. Where are we at in terms of getting responses on those recommendations? And I just want to call out the first line in green where Supervisor Natoli was really enthusiastic about this recommendation and has committed to holding public hearings on the monitoring reports as well as the consultant reports. And we're excited about that. We look forward to participating in that as PHAB. And we'd like to sort of see that continue even beyond his tenure. We're still working on some of these pieces, including the transparency and accountability piece. We issued a second letter last month. I'm not going to talk too much about that because hopefully everybody here has had a chance to read it. It's fresh on your mind. The outline is here in case you need to refer back to it. But looking ahead, we're very excited about the opportunity to talk to the Board of Supervisors or present to the Board of Supervisors about this set of recommendations. Previously, PHAB has written letters and they've gone out to the Board of Supervisors, and we really haven't had a chance to present or engage very deeply. So we're looking forward to that. As Farla mentioned, that presentation has been moved to May. So ahead of that, we're making sure we have another round of follow-up conversations with supervisors. You can see here what's scheduled and what's still being scheduled. And then coming out of today's conversation, I'd really like to make sure we connect with Catherine York. We get a walkthrough of that SIM diagram. And if anybody has any further recommendations for conversations we should have, we'd be open to that. I know I took us right up to the end. I had wanted to open it up to others on the working committee to add anything I missed or share their perspectives, but Farla, let us know where we're at with time.
Thank you so much for a very comprehensive view of the activities and the progress to date. That's marvelous. You can see how much time and energy has been put into this effort, and I'm very hopeful that there'll be lots more benefits reaped from it. So we generally take public comment throughout the meeting, so I'm going to ask for public comment, but if there isn't any, that's not unexpected. And we will have another update as usual from the working committee, maybe a shorter one in the next FAB meeting, so there'll be time for questions there as well. And if you have any questions, you can always email. The members can send me questions and we can put them on the agenda. Thank you so much for that. That was an excellent presentation. Okay, we'll have a lot more information for FAB the next time we meet, because as you see, there's a lot of activity coming up. I'd like to thank everybody for their participation today. It's great to see everyone on, all the guests to FAB. You're so very welcome, and all the members. Sarah has a comment before we leave, or a question? Sarah, I see your hand up.
No, I'm sorry. That was just technical difficulty. Thank
Oh,
you.
all right. Well,
Great
Sophia has
presentation,
one.
though. Fantastic presentation. Thank you.
Yeah, thank you. Sophia?
Oh, hello, good afternoon. I'm sorry, I actually can't open the participants tab for some reasons. I was wondering if Dr. Sandy Damiano is still in the meeting.
I think she had to leave.
Oh, okay, because I did have a few questions about vaccination rates for incarcerated individuals, and I was wondering if I would be able to receive her email.
Sure.
Yeah, I can put her email in the chat.
Yeah, that's
and then I
great.
think that's probably the best way. If you have some specific questions to get to her, that would probably be the best way. Thank you.
Okay, thank you so much.
And I just, one more plug for anybody, any of the FAB members who would like to join the working committee. There is that one other slot with another member of FAB on the committee. It allows us to add another community member as well. So just reach out and let us know if you have questions or concerns, just let me know and we'll discuss them and give you more information if you wish. Okay. I think that's it. All right. Thank you very much again. And we will see you in a month.
Thanks, everyone.
Bye.
Thank you.
Thank you.